can you first explain what this new variant really is and how it could affect us locally?
Yeah, so you've probably seen as we've worked our way through the Greek alphabet, the different variants that we've had, and that's because we need a name for these new strains of viruses, and because an alphabet letter is very benign, and that's what the World Health Organization has chosen. So we're all the way to Omicron or Omicron. Webster says either pronunciation is okay. And so this one's different, and each successive variant has been a little different than the previous, but the reason this one is generating so much concern is the number of mutations that are present in this variant compared to previous. We know that there's at least 30 mutations present, maybe more. And what that does is it changes how the virus looks to our body. So the vaccine, it works because it builds this memory in our immune system that allows our immune system to recognize the COVID virus when it comes into contact with our body, and our immune system's prepared once we've been vaccinated or if we've previously had COVID. This one, perhaps, we don't know yet, looks different enough to our immune system that we are concerned that the immune response might be less than what we've seen with other variants, or significantly less. Hopefully it won't be any less, and that the vaccine will be effective and continue to be effective with this variant and maybe others to emerge. But that's definitely what the concern is right now.
As is the case when we see new strains of any virus, COVID-19 in particular, it's constantly a fluid situation. We're getting new information every day. So from what you know now, do you believe our current vaccines are effective in fighting this virus?
I think it's best to say that we don't know yet. Most experts that weigh in on this, again, this isn't data, this is expert opinion, but most experts will say that there's good reason to believe that our current vaccines are going to have effectiveness against this variant. The degree of effectiveness, we definitely do not know that yet. So there's data being collected right now. It's being analyzed. We know that there have been a number of people in various countries that have been infected with the Omicron virus, and so we're just waiting to see. And fingers crossed that the vaccine remains effective.
In what ways can people protect themselves from Omicron? Of course, getting vaccinated is definitely a top one, but are there any other things people can do to keep safe from it?
Yeah, well, I mean, you led with the right one, and getting vaccinated is the most important thing. So, our hospitals are at capacity right now, and that's just with this Delta variant. So right now, across our footprint in the Northwest Ohio area, Southeast Michigan, our hospitals are severely strained, not only with COVID and with people that are hospitalized because of COVID, but because of a lot of other reasons. So there's a lot more people in our hospitals that have had their care delayed, sometimes postponed because of reasons related to the pandemic. And now they're coming in through our emergency departments and being admitted to the hospital. And on top of that, we have a staffing shortage. So we know that a lot of people have exited the workforce, and that's happened in healthcare too. So we're short on nurses, we're short on other staff members, and it's all those things coming together that are putting a big strain, which makes it all that more important that people get vaccinated. And then, of course, the other things we expect to be protective for the Omicron variant, like masking, social distancing, all those things should work too.
Finally, what are your concerns about this variant? We often hear about the concerns other people have, but for you as a health expert, what are some things you're concerned about?
I am concerned about all the things that we've talked about. I'm also concerned about the possibility of reinfection. We've had, millions of people that have had COVID and have recovered, and that does offer some degree of protection. And with the new strain, I'm concerned about the possibility of reinfection, and that natural immunity may not play a significant role in protection as we would hope that it would. And then in addition to, the concern that immunity related to receiving the vaccine could be less than what we've seen with other variants. So those are my biggest concerns. It doesn't appear initially that this variant is going to be more severe than previous variants, but again, the jury's still out on that, and we still have a lot to discover.